Assalamu alaikum, dear viewers, and very good evening, very good morning around the world, people who are watching us. We have very special guest with us today, Dr. Imran Sharif, who is right now at USA. Dr. Saab comes in different TV channels. He gives his analysis. Also, he's a assistant professor right now at a medical college. More we would like to know from Dr. Imran Sharif. Sir, welcome to the show.
First of all, बहुत शुक्रिया. Assalamu alaikum. Atik, thank you for inviting me at the show. And good evening to all the Pakistani viewers, and good morning to all the viewers in USA, and probably good afternoon in Europe. Uh, जी मेरा का जैसे you mentioned about all the activities that I'm involved with. So I'm a pulmonary critical care and sleep medicine physician by trade, and with that, other than providing जो भी clinical work है उसके अलावा मेरी इन्वॉल्वमेंट है काफ़ी मीडियाज़ के साथ जिसमें आई एम एक्सपर्ट एनालिस्ट एज फॉक्स न्यूज़, डेली मेल, जियो न्यूज़, और बाकी काफ़ी सारे चैनल्स हैं जिसके अंदर आई गो एज अ हेल्थ एक्सपर्ट टॉकिंग अबाउट डिफरेंट issues. So, inshallah, we'll be talking today about current challenges that healthcare professionals are facing dealing with COVID-19.
So kind of you, so kind of you. Sir, let's start with about the specialists available to us in this COVID-19. Do we have enough specialists who can deal with this?
Gee, means that's a really good question. As this pandemic started in December and around the globe after February and March, we were obviously not prepared and for the pandemic. Just to give example, United States has most of the specialists or most trained physicians in critical care medicine and emergency room medicine. And once we have physicians trained in different institutes, then they go in US and around the globe, which will be Pakistan, Europe, and other places. So जो ट्रेनिंग प्रोग्राम्स हैं वो इतने ज़्यादा हैं नहीं यहाँ पर, तो नंबर ऑफ फिजिशियन विच आर बीइंग प्रोड्यूस आर नॉट इनफ इवन फॉर यूएस. सो अराउंड द वर्ल्ड कैसे हम प्रोवाइड कर सकेंगे इसको. तो जस्ट टू गिव यू एन एग्जांपल, 3.6 पर थाउजेंड पॉपुलेशन फिजिशियन अवेलेबिलिटी है. तो आप इमेजिन कर लें कि 3.6 पर्सन किस किस तरह 1000 पेशेंट्स को मैनेज कर सकते हैं in a critical care situation, which could be intensive care unit, which could be emergency room. और जो कोविड के जो केसेस हैं, एज यू नो, मैं अभी लाइव अपडेट देख रहा हूँ, तो इट्स क्लोज टू लाइक 18,802,282 केसेस, और उसमें टोटल डेथ्स जो हो चुकी हैं वर्ल्ड में 706,443 डेथ्स. तो जो ये केसेस हैं, कॉम्प्लिकेटेड केसेस हैं, वो सारे आईसीयू और ईआर में होते हैं. तो हमारे पास इनफ स्पेशलिस्ट इस डिजीज़ को डील करने के लिए अवेलेबल नहीं है इन यूएस, नाइदर इन द वर्ल्ड, नाइदर इन पाकिस्तान. क्योंकि पाकिस्तान में भी काफ़ी सारे लोग जो हमने ट्रेन किए हैं वो पाकिस्तान में प्रैक्टिस कर रहे हैं, लेकिन दे आर हैंडफुल ऑफ देम. तो ऑब्वियसली नंबर ऑफ बेड्स, नंबर ऑफ फिजिशियन, उनकी एक्सपर्टीज इतनी अवेलेबल नहीं है पाकिस्तान में भी.
Right. Imran bhai, see, beside doctors, we need the nurses, we need, respiratory therapists. So how do you see their availability in general?
In general, even before the pandemic, nurses और respiratory therapists जो हैं उनकी availability कम थी. तकरीबन 5.9 million nurses की shortage है in the world. That's not talking about all over the world. तो आप imagine कर लें कि आप pandemic आ गया है, healthcare system is overburdened, hospitals are full, जो हॉस्पिटल के बेड्स हैं वो कम्प्लीटली फुल हो गए. अब आपने जैसे पाकिस्तान में देखा, लाहौर में, कराची में, कि तमाम हॉस्पिटल बेड्स फुल थे और उन्होंने एक्स्ट्रा बेड्स दे हैव आउटसाइड द हॉस्पिटल एंड क्रिएटेड एक्स्ट्रा वार्ड. तो if they've done those extra beds, so who's going to manage those patients? So this is just an example, and same thing is happening in US. There's not enough for nurses right now. I will just give you example of some of the hospital that I'm involved with, and the consultant and person who gives advice to the administration. So इस वक्त every single day there's a shortage of nurses, and the hospital administration from multiple hospitals, they have to keep calling multiple places every single day to get nurses on that one day. And once they are able to get some help, it's well and good for that day. But sometimes they're not able to get enough help, then the nurses have to work much harder with these complex and difficult cases. And the same applies for the respiratory therapists, that there's not enough of them, and the same issues happening every single day managing these COVID-19 patients, complicated patients with so complex issues. They are on the ventilator, they are on multiple drips, life-saving medication. So you have to manage all those things. One person cannot do it. You need to have a team, and you need to have enough time for the team to take care of all those changes that we are doing minute by minute, hour by hour.
Right. Imran Bhai, don't you see that, after this pandemic, governments must realize that, that how much they have to enhance the health facilities, that may God forbid if anything comes after, so we should be well prepared. At least, this pandemic must teach us this.
I completely concur with your point. After this pandemic means we should be prepared for the next one. As these viruses mutate, new viruses can come up, and as you know, uh, the origin of this virus is coming from China because of it's been linked to the exotic animal market, and humans eating those exotic animals, and those exotic animals carry different kind of viruses than humans. And once they find a host in humans, then they mutate and they spread like wildfire. The same process in COVID-19. And if the humans continue to behave similar way, getting involved in activities where they get exposed to these exotic animals or eating them, which should not be the case, then these things are going to happen and are going to keep happening unless we change our behavior. The human behavior have to change, and for that we need education, and we need more professionals to be involved. We need governments to be involved uh, to avoid the future pandemics. But the healthcare system will be overburdened with the next pandemic. This one we need to somehow manage with resources that we have available at this time, and everyone is working very hard.
Right, so true, so true. Imran bhai, you just mentioned that this virus, our body is the host of this virus. It means that once a person dies, this virus also dies.
So the virus, if virus gets out of the host, um, say for example, if the virus is on a glass or a metal or a wood, can live between 12 to 72 hours. So once the body dies, the virus obviously is going to die after certain time frame. So during that process, you have to be very careful handling the body. Unfortunately, if someone dies, then you have to follow the proper precaution, which have been suggested by the CDC, WHO. So there's a whole process of keeping this body in a way in the refrigerator or whatever the religious preference is, and follow that process of hygienic practice. So yes, the virus can be transmitted, to a living person in a certain time frame. As I said, we know that on metals and glass, it stays at least up to 72 hours alive.
Right, sir. Um, uh, Doctor, please do tell us that do we have enough ER and ICU available around the world to cope with this all?
Of course, ICU beds are overwhelmed, and every single day in US, the number of beds are being reported being running short. I can give you an example. That state of California, where I'm living, I'm from Los Angeles, California. So we had to continue to add extra beds, so create what you call temporary hospitals or temporary ICUs, just to accommodate extra number of patients. And with California now has the most number of cases, so we are always in short of ICU beds here in California and most places in USA. And the same applied to Pakistan. The number of beds in ICU were not available, to my knowledge, at least few weeks ago. Uh, as of today, obviously, I can't give you what is the situation, but a few weeks ago, I've been being contacted by different hospital people, locals, about needing help about COVID-19. And at that point, there was not enough bed even in Pakistan.
Right, right. There was a big shout by the doctors, in the beginning, and even I would say first month, second month, especially over here in Pakistan. I would like to know from you about the USA and the Europe that how it was about PPEs, personal protective equipments for the paramedical and the doctors working against this COVID-19.
I mean, COVID-19 is a very new virus, a very tricky disease, and we are still learning. And it's a very smart virus. And so, in order to fight against COVID-19, we had to make sure that healthcare professionals are well protected, which is not in US, not in Europe, not in Pakistan, all over the world, because the virus is moving. And so when this happened, at that time there was predictions that there will not be enough personal protective equipment, and we were running short in US. And as we see it on a daily basis, hospitals are hurdling and trying to get masks, gowns, face shield, and also what we call peppers. Uh, and same thing was happening in Pakistan, as in the news, that the healthcare professionals were protesting because they were not being provided with enough personal protective equipment. And the reason is we don't know about this virus. So you have to be very well protected, so that way you don't get the virus. If you get the virus, we will lose one more healthcare personnel who can help at least 10, 20, 30, 40, 100 people or more than that. So we have to be protective of our healthcare professionals. So yes, that issue is being addressed, and now things are getting better in US and Europe. There's enough personal protective equipment, and even in Pakistan, I can tell you that I run a non-profit organization which is called Pakistan Meri Jaan, and we have been providing personal protective equipment in multiple cities, multiple hospitals, multiple provinces in Pakistan on a very regular basis. And even we went, our volunteers went to these animal markets before Eid al-Adha, and they distributed free masks and taught the people how to wear, when to wear, and distributed free masks. So yes.
Mashallah, great, wonderful job. I didn't know about it, and it's really wonderful. Would love to collaborate and would love to have you with us because the thing you're doing that is just for Pakistan, but the way, mashallah, you're contributing, this is the real and great service to humanity. And I wish you all the best. Continue. We need, all the brothers and the sisters and our friends, all Pakistanis sitting abroad, definitely thinking about Pakistan and Pakistanis. Question comes here, Imran Bhai. Nowadays, I just know last, you can say 1 month was continuously traveling around Pakistan. I was in Balochistan to Sindh, Sindh to KPK, Punjab, and all over. One thing I found, I want to ask you that everywhere I saw that different kind of masks are available. Even the small children, they are selling, the masks or at the roadside. And I met a couple of people in Lahore who have started the business of making masks. But I could not understand, the criteria, the standard. Could you please explain it, that what kind of masks are good for us and what should be the criteria standard for this mask?
I think this is a really good question, especially for general public and audience. So first of all, why do we need to wear the mask? So we need to understand that, and then we need to see what kind of mask will actually be helpful for us. So people who are wearing the mask, a general population, they're basically trying to protect the other people, other person. So if you wear a mask, that mask will prevent you from spreading the virus, and the other people will not get exposed. Just in case if you're an asymptomatic carrier, which is a pretty big number of people who are asymptomatic, but they're carrying the virus. But if they wear the mask, they will protect other people who have, say, a heart disease or diabetic, or their elderly population. And if they get exposed to the virus, they can catch the virus very quickly. So that's one reason. Regarding the healthcare professional, they have to wear the mask to protect themselves. Say a person comes to the ER and has COVID 19. Now, that healthcare professional who's going to handle that person has to be well protected so that they won't get the virus. So they need to wear a different kind of a mask. So there are three main kind of mask, which is one is cloth mask, the second is surgical mask, the third is N95 mask. The cloth mask is basically it can be fabric with any kind of cotton that can protect you from spreading the virus. And the same applies for the surgical mask. So either one is fine if you wear, um, whether you are sick or not. As long as you're not a healthcare professional, you can wear either one of them, either a cloth mask or a surgical mask. And all the doctors, nurses, they should wear N95. N95 has a protection of almost 95%, where when you get exposed to someone who's coughing, sneezing, and when you cough and sneeze, the droplet are spread out everywhere, and that droplet carries the virus. And also in the air within the 6 feet distance, when they inhale and exhale, right, when they take a deep breath and when they take the breath out, they can spread the virus. So as long as you're wearing the mask, you're 95% protected. Now, there are one other equipment which we call pepper. Usually we use, it's like an you may have seen it on internet or YouTube. I have shown or distributed a video on YouTube where you wear a device which looks like an astronaut suit. You wear a headgear, and it's connected to a battery, and it generates positive ventilation. So when you're wearing that, it's like an astronaut mask and completely covered, and you have no way of air getting into the system. So you're not at all exposed to the outside air. So during when you're wearing that, you can do any kind of surgery. You can resuscitate the patient. You can, if the patient goes into cardiac arrest, you can do CPR and other things. So those are the different things that are available and which can be used in different situations.
Great, great, wonderful. It was really informative, and to know it in detail, I'm sure that would be surely helpful for our viewers and us. Um, Imran Bhai, testing kits. They were being, quite discussed earlier in earlier days because it was very expensive to test the COVID-19. And I heard from some of my friends, doctors, that it is the test of actually RNA, it's not, and then so on. I would like to just, know from your perspective, how do you see it? And is it really uh, we can call it, can we trust it? Is it the authentic one that yes, the person is being, diagnosed positive, he is positive? Because in many cases, different laboratories results were also different.
I
Please.
think it's a very good question. So first of all, the same concept applies that why do we have to do the testing and how accurate is the testing. So the testing needs to be done obviously so that we would know a person have COVID-19 or not. Now, there, as I mentioned, there are a lot of people will have active disease, and there is a small group of people where they don't have the symptom. So the people who have the active disease, you can treat them even if the test comes back negative because your suspicion is very high. And at this time, COVID-19 is the disease. So people who are asymptomatic, we need to do mass testing so we can find those patients or those people who are asymptomatic, and we can isolate them so that way they don't spread the disease. Now, the test is what we have available is not 100% accurate. Its accuracy is close to 80 to 85%. So if you do a test and if it comes back negative and if your suspicion is too high, you repeat the test. And if you repeat the test and if that repeat test comes back negative and if your suspicion is still high, you can treat that person as COVID-19. So sometimes we end up doing this testing multiple times in a person. And now the other issue with the testing was there's not enough testing kits available when the pandemic started. Now the things are getting better, but still there's not enough kits available. I mean, I can give you example in US. You go to certain ICU at certain emergency department, they have testing kit available, but limited, and they can get the results back in 2 hours. But if you go to any other lab other than the emergency department, they give you an answer within 5 to 7 days. Just imagine if you don't have the 2 hour kit available and if you do a test and that person is out there for 5 to 7 days, get exposed to another 1,000 people and carrying the virus, so you've already distributed that virus to another 1,000 people, and those 1,000 people got exposed to another few thousand people. So this is how this virus spread. So obviously we need a lot of testing kits, and obviously we need to get better with the testing. That way we can get it to what we call specificity or 100% accuracy of the test, which is currently not the case.
Right, sir. Right, sir. After this testing kit, the question comes about the treatment. For last, I guess, a month or so, we have been keep listening that UK has got the vaccination, and they tried over some people, results were good, and some other countries did it too. So, do you see that? Have we received? Have we got a treatment for this COVID-19, or still we have to wait?
I think so. Regarding the treatment, there are number of things that I would like to discuss and explain our viewers. So, first of all, there was a recent study which was published from UK NHS almost like I would say 6 weeks ago about steroids or Decadron, and they show promising results. Then there was a US-based company which has antiviral medication for Ebola, which is called Remdesivir. That showed some promising results. And there's another medication which is used for autoimmune disorder called Actemra, showed some promising results. Uh, patients who got infected with the virus, their plasma got extracted and given to people or patients who were infected with COVID-19. That showed some promising results. And blood thinner, or what we call anticoagulant or heparin. So all these are experimental treatments which are available, which are using in a different combination in different form. And there are multiple trials which are going on. Hopefully, we will have some kind of a better idea of which medication or which combination of treatment will work best. As Decadron showed significant improvement in getting them off the ventilator and getting them home quickly, duration of ventilator requirement decreased almost number of days. Same with remdesivir. So this is the experimental treatment and the data which we have available now. The way to finally treat this disease or take care of this problem is vaccine. And vaccines, there are almost 140 companies which are actively in hunt for the vaccine. As you mentioned, British, they have two different companies. One is AstraZeneca, the other is Oxford, which everyone knows. So Oxford trial was recently shared and showed some promising result, and they're going to the next phase where they will be using in thousands of volunteers. So we are still not finished. So when you're preparing a vaccine, it goes through multiple phases. So you have to look at their side effect profile. So that's going to be looked into, and also tolerability. So that's in Britain. Then China has two companies. One is the CanSino, and the other one is Sinovac. So Chinese have used their vaccine in military people, not civilians. So we are still waiting on what will be the outcome, and we don't have a lot of data available from that particular trial. USA Moderna is working very aggressively. They're also in a third phase. Russians, as you heard, recently claimed a few days ago on media that they have come up with a vaccine and they're going to be doing mass production in September of this year. Now, keep in mind, we don't have any data. The vaccine trial have not been published in any peer-reviewed journal, or it has not been looked by experts around the globe. So we don't know. This is just what we saw in the media. That's pretty much it. And we'll have to wait and see. So China and Russia are claiming that they are way ahead of everyone else, but we have not seen, and we have not seen the data. So we'll have to see what happened with all these countries: USA, Europe, China, and Russia. All four are on the hunt. They're all almost 140 companies working. So I think this year there's a good possibility we should be able to get a vaccine.
Great, great. Let's hope for the best, Imran bhai. As soon the corona came, one thing happened that that was lockdown. The world got a lockdown, which was really uncertain, unfortunate, but we all had to face it. We all had to accept it. What brought, somehow a lot of psychological problems with the people, confined in their houses, whether they were in Europe, USA, or the Asian countries like Pakistan. But when we talk about the families of healthcare personnel involved in this COVID-19, uh, to my personal observation, because I have a lot of relatives as well as friends like you who are doctors, the families themselves went into depression as well as great kind of anxiety because directly involvement with the COVID patients. and daily performing the duties of 12 to 14, 16 hours. How do you see it generally, that how did it work? How did it affect the health of families of
I think
medical professionals?
this is a very important question because we are always talking about general population, their health. We have to always think about healthcare professionals who are out there, how they are being impacted. They're also human beings. Their families are also human, and they're also psychologically and emotionally getting impacted. So some of the simple measures that I usually suggest to my colleagues and other healthcare professionals is when you go to the hospital, go to the clinic, or other places where you will be involved in the care of COVID 19 patients, make sure that when you come home, before entering the home, if you have accessibility to change your clothes, take your shower, and leave your clothes outside in an area where they can be washed and cleaned separately, so that will reduce the exposure of COVID 19, or God forbid, if anyone get exposed, at least they have taken enough precautions so their family is protected. Now, with that in mind, families of healthcare professionals obviously going through the same emotion, which is lockdown, isolation, anxiety, depression, post-traumatic stress disorder, which we're going to start seeing soon. So the best way to handle that is on a regular basis. You need to first of all have a regular routine that you means a certain time you will have breakfast. You need to have planned activities every single day, what you will be doing, whether uh, going out for a hike, some kind of exercise, bike riding, running, yoga, and other activities with your family, and have on time lunch, dinner, and very importantly, sleep. You need to have enough sleep because lack of sleep or too much sleep will also impact you significantly. So, so you need to have a proper routine. You need to talk to other people, and if it's possible, you can meet a few friends with the social distancing, wearing a mask, uh, talk about things, go out on a hike with your family, and some kind of activity, and have a regular routine in order to protect your family from anxiety, depression, post traumatic stress disorder, and other emotional issues which are happening right now in the families of healthcare professionals and also in general population.
Thank you very much. Dr. Imran Sharif was with us today as our special guest and answered about the questions about the challenges faced during this COVID-19. Imran Bhai, thank you very much for your precious time. I would request you to come again and again wherever the things are going on, so we can be benefited from your experiences, from your expertise, and from your knowledge.
Thank you so much, Atik, for inviting me. I really enjoyed. You had great questions, and I'm hoping that our discussion really helped the general population of Pakistan and around the globe. And I'll be happy to come back anytime you invite me. And before I leave, I would just request everyone to make sure wear your mask, hand washing, social distancing, carry a hand sanitizer, and just go with your regular routine. Make sure do some kind of a regular exercise, sleep well, and Eid Mubarak to all my Pakistani brothers and sisters. And
Khair Mubarak.
God bless you all. And inshallah, we'll see you soon.
Thank you very much. Thanks again, Dr. Imran Sharif. Thanks, viewers. Looking forward to see you again tomorrow with the new program.
Thank you.
Pakistan Zindabad. Thank you.
Pakistan. Thank you.